are the tooth infection symptoms, and what is a tooth abscess?
Symptoms of tooth infection can vary. A cavity, which is a hole inside a tooth filled with bacteria, is a type of mild infection. The symptoms of a cavity can vary from having no symptoms at all to having mild or moderate cold or hot sensitivity. If a cavity is not treated promptly, over time the cavity gets bigger and can get to the nerve of the tooth, causing an infection in the nerve of the tooth. The symptoms of an infection in a nerve of the tooth is usually sharp, shooting, spontaneous pain in the absence of any stimulus. For example, sharp shooting pain that wakes you up at night is usually a sign of an infected nerve. To treat an infected nerve, it usually involves root canal therapy to remove the infected nerve and any bacteria causing the infection, followed by a crown to protect the weakened tooth. If root canal therapy is not rendered promptly to treat the infected nerve, over time the nerve completely dies and all the spontaneous pain and symptoms from before completely go away because the tooth is now dead. Over time, the symptoms can reappear because the bacteria that's inside the root canal system starts to travel down to the base of the tooth or the base of the root and starts to create new symptoms, and these symptoms are usually a pressure sensation or even chewing that causes pain because the infection now has spread to the bone that's around the root of the tooth. Treatment at this stage still involves root canal therapy followed by a crown. However, if treatment is further delayed, this infection around the base of the tooth or around the bone of the tooth eventually spreads out to the gums around the tooth. And usually this creates an abscess, which is a localized collection of pus and bacteria. At this stage, the infection is no longer contained within the tooth. It has actually spread out of the tooth into the bone and into the gums. The good news is at this stage, root canal therapy and crown is still needed to resolve any symptoms and to get rid of the source of the infection, which is the dead nerve and bacteria inside the tooth. However, if treatment is still further delayed, eventually this abscess and this gum infection can start to spread into some of the facial tissues, sometimes tissues in the neck, and this can cause massive swelling, which can sometimes even compromise your airway space. Whenever this happens, this is an extremely emergency situation requiring hospitalization. If you have any questions regarding toothache, spontaneous pain, or tooth abscesses, please feel free to give us a call. We'll be waiting for your questions. Thank you so much for watching.